Hello, I'm Dr. Brad Holmberg, co-founder of InvisalignDoctors.com. This tutorial is an abbreviated version of arch development with Invisalign treatment. The full version of this tutorial can be viewed on our learning website, InvisalignDoctors.com. Arch development can consist of creating proper arch form, expansion, uprighting posterior teeth, and leveling the curve of spee. In the next series of slides, I will discuss these separately. The ideal arch form is ovoid. Aligners can modify the shape of the arches very effectively. Arches that display taper, square, or omega form need to be reshaped into ovoid form. Here are some photos of cases that are from my practice. These are the type of arch forms I see. You can see there's ovoid, there's a V-shaped, I call that Gothic. You have the square shape, the upper right one, narrow and tapered, or omega shape. Here are arches of a 60-year-old male patient I have treated in my practice. Note the square arch form, a 90-degree angle on the patient's right side. There is also kind of a little bit of an omega component of the upper arch on the right side. That's where the premolars curve in a little bit after the cuspid teeth. Here are screenshots of stage 0 of the initial treatment plan or ClinCheck. This is before any movements occurred. Here's a occlusal view of the ClinCheck for the same case. It shows the movement stage by stage. There were 37 regular stages. No additional aligners were needed to treat this case. You can see at stage 37 that the arches are ovoid form. This slide compares the proposed outcome, which is the final stage of the initial ClinCheck. That's stage 37. That's on the upper left image. And it compares it to the actual outcome, which is the after photo you see. Note how closely the after photo compares to the ClinCheck. And this slide shows the result for the lower arch. The upper left is the proposed outcome, stage 37 initial ClinCheck, and the photo is the after photo. And again, you can see how close they compare. So Invisalign can definitely reshape dental arches. Expansion is often needed to develop the dental arches. Narrower arches need to be expanded. This will create arch space. There are limits, though, in cases with inadequate periodontal support. You will need to use your discretion in deciding if you're going to perform this expansion. The next series of slides will cover expansion. There are two ways to expand the arches. One is by translation, and the other is by crown tip. The animations in the slide show these movements. Let's take a closer look at the movement of translation. Now, in the movement of translation, you can see it in this animation, both the crowns and the roots move together. This type of expansion is indicated in cases where the posterior teeth display the proper buccal lingual inclination to begin with. In other words, they're not tipped lingually. Now, the movement of crown tip moves the crowns of the teeth, but the root apices are not moved. This expansion is desirable in cases where posterior teeth display lingual inclination to begin with. Consider joining our community of Invisalign doctors on InvisalignDoctors.com. This tutorial and many more can be viewed in their entirety on our site. Personalized case assistance is also available.